If at any point during our educational videos you have more questions or would like to schedule a consultation, just click the Schedule Now button to contact our office. Hi, and welcome to our seminar series on fibroids. We're going to teach you everything you need to know about fibroids, as well as all of your treatment options. Today, you're going to learn a series of things. We're going to start with a little bit about myself, a little bit about my education and my background. We're going to talk about the Fibroid Treatment Center, as well as what we offer and what's unique about the Fibroid Treatment Center. We're going to then discuss a little bit about what fibroids are, how they form and why they form, and who's more likely to get fibroids. Once we've talked about who gets fibroids and what they are, we're going to talk a little bit about the symptoms. And we're going to try to help differentiate between fibroid symptoms and normal female symptoms. We're going to talk a little bit about the complications of fibroids and what can happen if fibroids remain and if they remain untreated. We're going to talk a little bit about when you should be seen for your fibroids and who you should see for your fibroid treatments. We're also going to talk about the different types of diagnosis for fibroid disease and what tests you need to have done either before you come to our office or tests that we may offer in order for you. We're going to talk a little bit about what happens at a consultation with us, the things that we'll do and the things that we'll talk about, and a little bit about the experience that you'll have during your consultation. Once you know who to see and when to see them, we're going to talk about all of your different treatment options. The options for treatment are going to be anything from conservative management and just watching, all the way through all of the surgical interventions that are offered. We're going to talk about the pros and cons of each of those treatments, as well as how you can choose which treatment's right for you. We're going to talk a lot about uterine fibroid embolization. We're going to talk about what uterine fibroid embolization is, how it's performed, whether you could be a candidate for UFE. We're going to talk about the side effects and some of the results from uterine fibroid embolization. We want you to have a clear understanding of uterine fibroid embolization all the way from the indications, the treatment, as well as the results from it. We also want to talk a little bit about how to choose a doctor for your fibroids. Whether you choose a gynecologist or whether you come to our center, we want to discuss a little bit about the things that you should be looking for and asking about your physician that's taking care of you. We want to talk a little bit about the Fibroid Collaboration Network. We're going to introduce the Fibroid Collaboration Network, tell you what it is, and tell you why it's important for you and why you should be involved with the Fibroid Collaboration Network. We're going to end with talking a little bit about where you go from here. We're going to talk about insurance as well as the next steps that you need to take back control of your life by taking control of your fibroid disease. With that introduction, let's jump in and discuss fibroids.
You trust these doctors that they know what they're doing and that they give you all the options that are available. But again, after talking to my friends and relatives, I discovered that there's many options.
UFE has made a significant improvement in my quality of life, and to anyone out there suffering from fibroids, I say do your research. Know that you have choices, know what those choices are, and take the appropriate action for you.
We know that fibroids can be very personal and very intimate, and that's why we want to thank our past patients who have given testimonials and given you information on their fibroid treatments. It helps everyone understand more about the process of seeking treatment and getting help. We wanted to take a few minutes and introduce ourselves. My name is Dr. Todd Harris. I'm the Medical Director for the Fibroid Treatment Center. I'm board certified in general surgery, but also have gone and done an additional fellowship in minimally invasive procedures, including fibroid treatments. This combination of surgery and minimally invasive treatments has led me into the field of fibroids and helping women who suffer from fibroid disease. I've been in Orange County for 6 to 7 years and been medical director of the Fibroid Treatment Center for the last several years. What separates myself from other physicians in the area? My education in combination of general surgery as well as minimally invasive treatments allows us and allows me to be able to offer you and discuss with you the full range of treatments. We're going to talk a little bit about that in one of our other seminars, but having that experience of surgical and minimally invasive options, I think, is valuable to patients. The Fibroid Treatment Center is a comprehensive center where women can come and have all of their tests, consultations, as well as any imaging and some of the treatments for fibroids. The Fibroid Treatment Center is one of the only centers in the country that can provide a whole range of services in one facility. Most physicians who treat fibroids will send you to another facility for an ultrasound or an MRI. They may see you at their office for a consultation, but then you may have to go to a hospital or to another facility for treatment. We focus on fibroids and all of the treatment options. So by coming to our center, you can have ultrasounds, you can have your MRI, you can discuss all of your treatment options, as well as having some of your actual treatments performed here. The Fibroid Treatment Center is also unique in that one of our most important features is patient education. We truly want our patients to be educated on fibroids, as well as all of the treatment options. We know that learning about fibroids can be overwhelming and can be intimidating. That's why the Fibroid Treatment Center is unique, in that our blog, our Facebook page, as well as the videos that you're watching today, can help educate you and take that worry out of your life and can simplify the process of getting you educated about fibroids as well as the treatment options. By having a comprehensive center like the Fibroid Treatment Center, you can ensure that you're getting the best care as well as the most comprehensive care.
The Fibroid Treatment Center and the Procedure Center are in the same location, which is convenient because your initial appointment with the doctor is there, your procedure with the doctor and the staff is there, and also your follow-up with the doctor is there. So everything is right there in one building.
Yeah, my GYN wanted to do a hysterectomy, and I thought about it, I looked into it, spent a lot of time talking to friends, and I actually found Dr. Harris online and just decided that I'd come in and talk to him about the options. I just was scared of hysterectomy, so.
I actually found the Fibroid Treatment Center when I was conducting research on doctors in Orange County performing UFE, and I saw that Dr. Harris had all excellent reviews from some of his past patients, and I also like Dr. Harris's videos. Dr. Harris has a video explaining UFE from start to finish, and in that video he also shows you all of the equipment that he uses during the procedure, and he explains exactly how he uses it, and that just really put my mind at ease about having the procedure because I had trepidations about it, and that just really helped to alleviate my fear.
Staff was so friendly and so nice. I was never left by myself. Prior to Dr. Harris coming in, there was a nurse explaining everything that was going to happen. My husband was able to stay with me, hold my hand until they wheeled me in. And then they wheeled me into this room, and it was not what I expected. It was just so state-of-the-art, you know, with the screen and the technology they had, but everybody was so friendly. They all introduced themselves. It was great, and afterwards Dr. Harris came by and made sure I was doing fine, and it was really nice. It felt very comfortable.
One of the most important things that we want to help you with today is learning about what fibroids actually are and what they are not. Fibroids are very common. As a matter of fact, 70 to 80% of women in their life will develop fibroids. A fibroid is just a benign tumor inside the uterus, which grows unusually large when compared with the uterus. Fibroids are not cancer, and that's one of the most important things that we want to educate you on. Fibroids are not early cancer, they don't become cancer, and they'll never turn into cancer. Fibroids are simply a benign growth within the wall of the uterus. This benign growth can cause a variety of symptoms, which we'll talk about later. But again, it isn't a cancer. Fibroids can range from very, very small all the way up to several feet in diameter. Most women have, on average, 6 to 8 centimeter fibroids. Fibroids in and of themselves are essentially the same no matter where they're located within the uterus. However, you may have heard that you have a submucosal or a subserosal fibroid. That's simply describing where the fibroid is located within the uterus. A submucosal fibroid is a fibroid that's located just underneath the inner lining of the uterus. An intramural fibroid is a fibroid that's located within the body or within the wall of the uterus itself. A subserosal fibroid is a fibroid that's under the outer lining of the uterus. So the different types of fibroids can be submucosal, intramural, or subserosal, depending on where they're located within the uterus. You may also hear that you have a pedunculated fibroid. That simply is a description of how the fibroid is attached to the uterus, and in some women, the fibroid hangs off the edge or the inner lining of the uterus. It's nothing concerning, it's simply just a description of your type of fibroid. A lot of women ask, why do I have fibroids? The truth is, we don't really know, and we're not sure why some women have fibroids and other women do not. We do know that fibroids can be hereditary, and they've actually shown that female twins have a higher rate of fibroids than twins who are not identical. We also see that women who have grandmothers and mothers with fibroids are more apt to have fibroids themselves. Certain women of different ethnicities will have increased risk of fibroids, such as African Americans, which have probably an 80% risk of having fibroids at some point during their life. We also know that progesterone is one of the stronger indicators of fibroid growth. And as a matter of fact, fibroids have higher progesterone receptors on them than the rest of the uterus. Women who have had multiple pregnancies, multiple babies, are protected from fibroids because their hormones have changed during those pregnancies. The typical age range for developing fibroids is in a woman's 40s. During that time, a woman's estrogen begins to decrease and the progesterone takes over. As we mentioned, fibroids are very progesterone sensitive. So as that progesterone increases, fibroids tend to grow during a woman's 40s. The average age of diagnosis for fibroids is 43 years old. If you look at medical studies in women, certainly they can be diagnosed much younger if they're causing symptoms, or even older, but the average age is about 43 years old.